we'll go ahead and get started. Thank you all so much for joining us today. I just wanted to let folks know that we will have an opportunity for Q&A following the briefing. After we're finished with the presentation, we'll open it up for questions, and you can either put your question in the chat or raise your hand and unmute yourself and ask your question after we call on you. So let's go ahead and get started. I will turn it over to Taylor West, who is the Executive Director of the Healing Advocacy Fund.
Thank you so much, Maddie, and thank you to all of you for being here today. This is a really exciting time for us. Colorado is about to become the second program in the nation to offer regulated access to psychedelic therapy, and we at Healing Advocacy Fund have been working toward this time for quite a while. But I'm going to start out by giving a little bit of an overview about Healing Advocacy Fund and about psychedelic therapy overall, and then I'll pass it on to the other speakers here. I'll introduce each of them as we come in, so you'll get a chance to learn from them and about who they are. But first, I'm going to start out talking a little bit about Healing Advocacy Fund. We are a 501c3 nonprofit dedicated to the implementation and supporting the success of state-regulated psychedelic therapy programs. We're currently working in Oregon and Colorado, and we're using what we learn in each state to build a model for state-regulated psychedelic therapy that can work well in these two states and in future states. And because we're working in both states, we're seamlessly able to bring lessons from Oregon into Colorado as the program is opening. And we're taking some of the improvements that we've made in Colorado back into Oregon to continue to strengthen that program. In Colorado, some of the improvements that we've made that are built on lessons that we learned in Oregon including dual licensure from the start, which means we are allowing for licensed clinicians in this state to actively participate in the program without any ambiguity about the way that they are participating. That's a policy that we'll be working to bring into the Oregon program in the upcoming year. We're also working on incorporating a robust outcome measurement from the beginning in the Colorado program so that we can really see what's working and improve on what's not. We increased facilitator training requirements, encouraged the state to adopt more extensive training requirements than we initially had in Oregon, and worked with the state on developing more flexibility for providers so that we can prioritize accessibility for clients, as well as include flexibility about where psychedelic therapy happens. To give you a quick briefing on sort of the background behind psilocybin research, a number of studies from leading academic medical research institutions, places like Stanford, UCLA, NYU, Johns Hopkins, have demonstrated that psilocybin has remarkable promise for a number of mental health challenges, including depression, end-of-life anxiety, addiction, things that our society is really struggling with. It's also worth noting that psilocybin has a breakthrough therapy designation from the FDA for two mental health disorders, treatment-resistant depression, which affects about a third of people with depression, and for major depressive disorder, which is a severe form of depression. That breakthrough therapy designation means that FDA believes psilocybin may demonstrate substantial improvement above and beyond what's currently available for treatment. In Colorado, we know that we're dealing with a mental health crisis, much like we are in the rest of the country. And that's part of the reason that psychedelic therapy has been supported by voters and by many in the mental health care field. This current crisis is large. It is ongoing. You can see some statistics in this slide about how it's affecting Coloradans. And a lot of our current solutions, like SSRIs, help some people, but leave far too many people without the tools that they need. In the state programs, psilocybin therapy is not just taking mushrooms. It is a model that includes multiple steps. This is a model that's been implemented in Oregon already and will be part of the Colorado program. Facilitators in Oregon spend up to 11 or 12 hours total over days and weeks preparing and then executing on the administration session and following up with an integration session afterwards. So there's really a 4-step process here, as you can see on the slide. There's an assessment, a screening process that helps match the client with an appropriate facilitator, as well as screen for any concerns around contraindications. There's preparation, in which the participant works with their facilitator to talk about the things that they're wanting to address, and talking through things that might arise during the therapy. There's the administration, which is the sort of medicine session that's held at a licensed location, overseen by the trained facilitator, and supported by that facilitator throughout. And then finally, there's an integration, which is really the part that comes after, and usually happens within a few days of the administration session, to really talk about the things that came up during the administration session and how to integrate those into the changes that a person is looking to make in their life, or to learn from the things that arose. And at no point in this process are any of the medicines sold as retail. Are any of them taken outside of the licensed location, or any of them used without the supervision of a licensed facilitator? Just a quick review of what's happening in Oregon right now. The last year and a half in Oregon, which is when Oregon started receiving clients, uh, almost 8,000 clients have been served. We expect more than 8,000 will have been served by the end of this year. There are 30 or more licensed service centers across the state, and more than 380 licensed and trained facilitators. This program has rolled out somewhat quietly, in the sense that I think that people don't quite realize the scale of the number of clients who've been served. And most importantly, we're hearing from these clients that the program is bringing them healing. Starting in January, Oregon will be implementing a data reporting effort that was not integrated into the program at the very beginning. And we will start to see more data coming from Oregon about the scale and the numbers. We'll have more exact numbers to share, and we'll be able to understand more about what's working there. Client safety is embedded into these state programs at multiple points during the process. It's one of the most important things that HAF focuses on, and one of the reasons why a regulated access program is such a good way to approach this therapy. There are, as I said, through the process, there is matching of clients and facilitators. And in Colorado, for instance, as Tasha will get into a little more, we have the ability to actually distinguish clinical facilitators, people who have additional clinical training, so that we can make better matches between clients who might have more elevated needs. We have the screening to rule out health issues. We have the development of safety plans to address issues that may come up during a session. The training involves specialized curriculum requirements and hands-on practicum experience. And we're building a data and outcome reporting system so that we can learn about what's working and make improvements on what's not. Within HAF, there are a number of things that we're doing to increase access to these programs and to accelerate adoption. This includes lifting up stories of what the industry is doing and advocating for providers with state regulators, so that we can develop better viability for the overall programs. We are working on real world research, pilot research in Oregon, starting with an alcohol use disorder pilot next year, with the goal of demonstrating the effectiveness of psychedelic therapy to governments, to the general public, and eventually to potential insurers. We are working to make sure that medical professionals can bring their expertise and skills into the program. That's the dual licensure that I was referring to earlier. And we're supporting innovative models of care and access funds. In Oregon, for instance, there is the Cherie Eckert Foundation, which is providing scholarships for both training facilitators and for clients to access the program. And Bendable Therapy is a nonprofit in Bend, Oregon, that works to provide services at a cost that's accessible for those who need it. Finally, to talk about the why of state regulated programs, there are efforts at the federal level to work towards prescription access, FDA approval, those sorts of things, and that sometimes raises the question of why we move forward with a state regulated program instead of waiting for that federal process to go through. I think the first reason is the waiting, right? This is a crisis that we're in, and this is a tool that we can add to our toolbox that we shouldn't continue to wait for while people are struggling. But outside of that, state programs are currently the only way that a broad swath of people seeking healing can have access in a legal environment. These state regulated programs work as a complementary pathway to the work that's being done at the federal level. State regulated programs also allow people to use this medicine and these treatments for more than just a narrow, specific diagnosis of a condition. So people can use them not only for when they're having a mental health crisis, but actually use them to build up resilience and wellness before they experience a mental health crisis. And that's something that doesn't happen within a prescription-based program. State programs are also more nimble and responsive to the fact that we have a wide variety of mental health needs, and they can be deployed more quickly than the limited access that's currently available right now only through clinical research trials. We continue to see real challenges with the federal pathway, given the cost and the time that it takes to go through an FDA process. And until and unless that pathway becomes more open, then state programs are offering another route to what are very desperately needed access to treatments. So with that overview, I'm going to hand it over from here to Tasha Poinsett, who is the Colorado State Director for the Healing Advocacy Fund. And Tasha is going to take us through a few more detailed explanations of the Colorado program itself.
Thank you. Thank you, Taylor, and thanks everyone for joining us today. It's great to see so many of you on. My name is Tasha, and I'm the director here in Colorado with HAF. So just to give a quick overview of what we passed in Colorado in 2022, the Natural Medicine Health Act primarily did three things. The first of which is to create this state-regulated model for adults 21 and over to access psilocybin therapy from licensed facilitators at licensed locations with the screening, preparation, and integration that Taylor described. And that specifically is what's launching next year in 2025. We also, the state also voted to decriminalize the personal use of 5 naturally occurring psychedelic substances for, again, adults 21 plus, which took effect in December of 2022. So that's been in effect for almost 2 years now. And then finally, civil protections were included for professionals who want to participate in this program, basically stating that conduct that's made legal should not be used to discipline them. And this is a really important piece because it's part of how we can ensure that there's participation by our licensed medical and mental health providers, that there's actually protections for them to directly participate in this program. And there's also been a lot of work behind the scenes, conversations among the different licensing boards and education to make sure that there's recognition of the intent of this program, the structures and supports around it, so that those people can actively participate and lend their expertise and skills to this therapeutic access model. One thing that this program is not is a dispensary or retail sale model. So as Taylor mentioned, nobody's taking the mushrooms and then just kind of using them on their own time without that supervised structure and support structure in place. So in terms of the timeline, as I mentioned, this passed in November of 2022, and the measure included a 2-year rulemaking period for the state agencies to develop all the rules and regulations around the program. And so we are right now close to the end of that 2-year process, which involved the governor appointing an advisory board, the Senate approving that advisory board, and then months of them bringing in expertise across psychology, psychiatry, pharmacology, indigenous wisdom keepers, social workers and other experts to inform how we could really responsibly build out this program. And so with all of that falling into place, we now do have final rules for much of the program, and the state agencies are going to begin accepting applications for licensure at the end of this year on December 31st. In terms of who those state agencies are, so 2 agencies are tasked with regulating this program. The first of which is DORA, or the Department of Regulatory Agencies, which specifically is going to license the facilitators who will be providing all of the support to participants in the program. And DORA is the same agency that licenses and regulates a whole host of other healthcare professions in the state, including, doctors, nurses, et cetera. So it really made sense for them to have that same regulatory role with what is, in essence, a new profession in the state of Colorado. And then the other state agency is the Department of Revenue, which is going to be licensing and regulating all of the businesses. And so that's the healing centers where these sessions take place, as well as the cultivation and manufacture of the natural medicine or of the psilocybin mushrooms themselves, and then laboratory testing as well to test for the potency of the mushrooms, as well as identify contaminants and anything along those lines, make sure that it is a safe product for consumption in these therapy sessions. And a few other pieces that I think really set Colorado's program apart is that there's a required safety screen that Taylor alluded to. And the development of this safety screen, again, was really informed by that outreach process to mental health and medical providers in our state. In fact, a group of dozens of providers, mostly affiliated with the UC Health system, collaborated to recommend a screening form to the state. And these are all the pieces that are going to be included in that screening form when somebody is first kind of reaching out to seek access, to see if psilocybin is a good fit for them, and then also match them to the facilitator. So it's reasons for seeking access, history of psychedelic use, health history, mental health, medical health, pharmacology, and then other considerations. And, one thing I like to note here, I do think the screening piece is quite important to make sure that people that are seeking this out are a right fit for it. What we do know from the research is that psilocybin is overall a very safe compound for most people. And what I mean by that is it doesn't actually come with a lot of physiological risks. It's non-toxic. So you can't, for instance, overdose on psilocybin in the way that you can on other drugs. It also doesn't create a physical dependence in the way that some other addictive substances can. And so it is safe for most people, but there are a few indications that might increase risk. So certain mental health conditions like schizophrenia, schizoaffective disorder are believed to potentially increase risk for consuming psilocybin. And so those are the types of things that you're going to want to screen for in this required safety screen. So in terms of how the safety screen is implemented in Colorado, it's really tied in with this concept of scope of practice. And so if you want to move to the next slide, there are 2 facilitator types, which I'll get into in a minute, clinical and non-clinical. And so when the safety screen is administered, if it identifies risks that fall outside of a facilitator's scope of practice, there's a requirement for the participant to then separately undergo medical risk review and consultation with somebody who does have that risk factor within their scope of practice, medical or mental health risk review and consultation. And so really there's an additional touch point there, making sure that they're interacting with their medical provider, mental health, to more fully understand that risk and then make a very informed decision as to whether to move forward with the psilocybin therapy process. And then there's a few additional guardrails in Colorado's program that are worth mentioning. And so there are minimum session lengths spelled out by the state. And this is the minimum amount of time that a facilitator must be present with a participant after they've consumed the psilocybin. And that's going to be 5 hours for most people. The sessions could go longer depending on the individual person's experience, and they do need to last as long as that person is still feeling the effects from psilocybin. There's also a requirement for a safe transportation plan after the psilocybin session, which cannot involve the participant driving themselves or self-operating any transportation. And then there needs to be a safety plan that the facilitator and participant develop in advance of the session to make sure that they're prepared for anything that could come up and that they have a support system in place for them afterwards. And then finally, of course, there's age restrictions. No one under 21 may be present during one of these sessions, and psilocybin has to be stored in a locked place that is monitored by camera and really restricted access only to licensed people within this program. And so then, just a quick reminder of the 4-step process that Taylor mentioned: assessment, preparation, administration, and integration. This is not, happening without this supervised structure in place. And there's a question of where is this going to be taking place? And so several location types are contemplated in this law. This is in general going to be happening at what's called a healing center, a licensed healing center. And there are 2 types of healing centers, micro and standard. The micro healing center is really designed and intended for instance, sole practitioners or small group practice therapy offices that want to add this as a modality of care, but don't necessarily want to make their entire practice focused on psilocybin therapy. So many of them express that they might want to do this once or twice a month, offer it really where it makes sense for their individual client. It could also occur at existing healthcare facilities. There's an option for retreat model, which can be important because retreat essentially implies that there might be an overnight component where people are actually continuing to process and work through whatever came up during the session, perhaps for a number of days following the session. And that supportive environment can be another great way to ensure that people really maximize the benefit from the therapy. And then finally, in certain situations, this can take place at participant homes, and there are additional safety requirements that are applicable in those instances. So as I mentioned, there are 2 license types for facilitators: clinical facilitator and non-clinical. And a clinical facilitator is someone who separately holds a license to practice medicine or therapy. A facilitator does not, although they might hold other licenses that are within the realm of medicine or wellness, such as massage therapists, acupuncturists, registered nurses as well. And the education requirements are the same across the 2 groups. There are some accelerated options for clinical facilitators that have prior training that overlaps with the education requirements. And both groups can integrate their other license into their practice of natural medicine in terms of how they offer support before and after these sessions. And so they can integrate, for instance, ongoing counseling or therapy sessions. The required training that the state landed on is 150 hours of coursework, followed by a required 40 hours of supervised practice that has to happen in person, where people are directly facilitating as well as experiencing facilitation. And then the 3rd step is 50 hours of consultation that the facilitator receives from somebody who's more experienced in facilitation while they've begun to actively provide natural medicine services. And then in addition to that, there is a requirement that they're trained in basic life support. In terms of what's included in those 150 hours, it's a pretty robust set of requirements regarding screening, the different components: preparation, administration, integration. Intro to trauma is very important because a lot of people that are seeking access are people that have a trauma history, and so knowing how to navigate that and offer support. Drug effects and contraindications, and of course, more broadly, physical and mental health and ethics is very important in the training. In terms of the training pathways, the original licensure pathway is what most people are going to be pursuing, and so that's everything that I just described. There are a couple of accelerated options for people who have significant prior training and experience. And then there's also portability with Oregon licensed facilitators who have been practicing for at least 1 year to be able to seek licensure in Colorado. And then finally, the standards of practice are really laid out very clearly by DORA in terms of informed consent and disclosures for participants. Very clear boundaries in terms of the relationships between facilitator and participant. as I mentioned, screening, safety and support plans. There are dosage guidelines included and specific requirements and limitations for group sessions. And finally, I think it's important to note that specifically 10 training programs have been approved by the state of Colorado and are currently offering training to future facilitators and clinical facilitators. And so this slide just shows those 10 programs that have been approved, and really excited that with that process underway, there are going to be people that are ready to apply for licensure once the opportunity opens up starting next year. And I would say, just in terms of the timeline, we do expect there to be some lag from the date when the license application portal opens to when we see the first healing centers serving participants. So we do expect the first healing centers to be operational in the summer of next year. So with that, I want to go ahead and hand it back to Taylor to introduce a couple of our other speakers.
Thank you so much, Tasha. We're going to have quick messages from a few folks, two folks who are looking ahead to being facilitators in the Colorado program, and then also from a facilitator who is working in the Oregon program to talk a bit about their experiences there. First up, we have Mickey Vogt. She's a licensed professional counselor and addiction counselor in Littleton, Colorado, and I will just hand it to Mickey.
Hi, thank you all for being here. My name is Mickey Vogt, and I'm a licensed professional counselor and addictions counselor here in Littleton. I'm 6 years into a thriving private practice with over a decade of community mental health experience, and I also own and steward a wellness center. With Colorado's psychedelic therapy program set to launch in 2025, I am eager for the huge impact this will have on the health and wellness of our communities. I'm looking forward to becoming one of Colorado's first psychedelic therapy facilitators so that I can offer this cutting-edge therapy to my clients. After working closely with DOR and DORA over the last year and a half to establish the infrastructure of this program and co-authoring the standardized safety screening form with other members of the Psychedelic Public Policy Partnership, I'm now preparing to submit my application to DORA for my clinical facilitator license. I'm also in the process of designing and developing a practicum training as the clinical director for the Center Origin that will be held in partnership with some of Oregon's and Colorado's approved didactic training programs. Additionally, I have created and have been presenting informational presentations as an educational initiative to medical and mental health providers in Colorado, familiarizing them not only with the state-regulated model, but more specifically, psychedelic-assisted therapy and its relevant uses and benefits. The legalization of psychedelic therapy in Colorado is a game changer for therapists like myself, who are constantly searching for more ways to help our clients heal from debilitating conditions like depression, anxiety, addiction, and PTSD. We know, thanks to a growing body of medical research, that psychedelic therapy using psilocybin mushrooms can bring lasting relief to those who simply haven't had success with any other mental health treatment. For many, this has entailed trying medication after medication, experiencing unwanted and sometimes debilitating side effects, and spending thousands of dollars on therapy only to get little to no relief. What clients never want to hear, and what mental health providers never want to say, is that there's nothing else we can do. But sometimes the therapies and modalities we have just don't work for people. That's why having psychedelic therapy as a new tool in our toolbox is monumental for mental health care in Colorado. This program is geared toward helping therapists like myself offer research-backed psychedelic therapy to our patients in a safe and supportive setting, in addition to making psychedelic therapy as effective and as accessible as possible for all Coloradans who can benefit from it. Thanks to the hard work of Colorado policymakers, regulators, and advocates, I will soon be able to offer an alternative pathway to healing for so many who are struggling and losing hope. It's great to be here today, and I'll turn it back to Taylor.
Thank you so much, Mickey. Next up, we have Erica Messenger, a registered nurse in Dolores, Colorado, who's going to talk about wanting to provide services on the West Slope and in parts of our rural parts of the state. Go ahead, Erica.
Thanks, Taylor. Thank you all for being here today. My name is Erica Messenger. I'm a registered nurse in Dolores, which is a rural community in Southwest Colorado, specializing in community and rural health. And I'm a doctoral and psychiatric nurse practitioner candidate at Johns Hopkins University. I also served as an advisor to DORA's Natural Medicine Advisory Board on the Emergency Response Safety and Ethics Subcommittee. So as a rural healthcare provider, I'm all too familiar with the serious and deadly mental health crisis in Colorado's rural communities. Colorado is second in the nation for the prevalence of mental illness among adults and fifth for the number of adults with serious thoughts of suicide. In Colorado's rural areas, suicide rates are consistently higher. Our veterans in Colorado complete suicide at roughly double the national average. I'm tired of seeing people in my community struggle with anxiety, depression, addiction, eating disorders, PTSD, and many other conditions, even though they are trying their best to heal with available therapies and modalities available to them. So psychedelic therapy, to me, presents a new hope for Coloradans who continue to suffer from debilitating conditions, treatable conditions, despite our best efforts to help them find relief. Everyone in our state, no matter their zip code, deserves equitable access to the most effective evidence-based treatments available. So I plan to complete the psychedelic therapy training after completion of my doctoral program, so I can provide this therapy in the safest way possible. Colorado's psychedelic therapy program has been painstakingly structured. I know I've attended almost 100 of these meetings to ensure high quality training for facilitators and has established clear best practices to make sure that this therapy is safe and effective. So as the program gets off the ground in 2025, we have to ensure that Coloradans in every corner of the state have access to the healing potential of psychedelic therapy administered in a safe, well-regulated, and supportive setting. My hope is that local governments all across Colorado, particularly in rural areas, will recognize the value of these evidence-based therapies for the members of the community who need it most and ensure that this therapy is accessible to them. In order to effectively combat Colorado's mental health crisis, we must open new and innovative pathways to healing before it's too late for our friends, our family members, our neighbors, and our veterans who are frankly losing hope. As we step into 2025, I'm looking forward to seeing the positive impact this can bring. Thanks, Taylor, for letting me speak. I appreciate it.
Thank you for being here, Erica. I'm now very pleased to introduce Arapahoe County Commissioner Jessica Campbell, who will talk about the importance of protecting access to healing centers at the local level. Commissioner?
Thank you, Taylor. And hello, everyone. I am Arapahoe County Commissioner Jessica Campbell. And thank you to everyone for being here today to discuss the launch of this critically important, safe, regulated natural medicine program in Colorado. Research from some of the nation's leading institutes has continued to show that natural medicines can help treat some of our most prevalent and serious mental health and behavioral health conditions, including depression, anxiety, PTSD, substance abuse, and more, which is incredibly poignant when you think about gun violence, the number of veterans we have in Colorado, the number of sexual assault survivors that we have in Colorado, and the healing that they may be able to get. It's no secret that our nation and our state are facing a persistent mental health crisis, and it's time to embrace innovative treatments that can help make a difference. That's why I'm proud to say that Arapahoe County is leading on this issue and ensuring that members of our community who are suffering can benefit from safe, facilitated psilocybin therapy and can access it at designated sites in our community. As other counties and municipalities work to implement regulations for healing centers, I encourage them to remember that Colorado's psychedelic therapy program does not allow retail sales, and there will not be dispensaries in any Colorado communities. Colorado's psychedelic therapy program does not allow access for minors or marketing to minors, and that remains, as it always has been, illegal. All regulated natural medicines used in therapeutic services must be secured in a licensed facility in locked storage accessible only to authorized employees of the licensed facility. Colorado's psychedelic therapy program is also estimated to be less than 1% of the size of Colorado's cannabis market, but could make 100 times the difference in patients' lives. Most importantly, I would urge local decision makers to think about the veterans, patients, survivors, and others suffering in our communities right now who could benefit from this therapy. While local governments rightly have the ability to determine when and where healing centers can operate in their communities, it is critical to ensure that all Coloradans have access to the healing potential of natural medicines, regardless of their zip code. Regulations forcing Coloradans to travel outside of their communities can create accessibility issues, particularly for veterans or people with disabilities, Coloradans living in rural regions of the state, and low-income Coloradans who already face healthcare barriers. I look forward to the launch of this program and the hope it may provide for people in my community and others across the state. Thank you for having me, and back to you, Taylor.
Thank you, Commissioner. And finally, we're going to hear from Emma Knighton, who is the Director of Services and Programs at Intertrek Service Center and Training Program in Oregon. Emma is going to talk a bit about the experience that they've had and that Intertrek has had in operating in the Oregon program over the last year and a half. Thanks so much for being here, Emma.
Thank you, Taylor. So as Taylor said, I'm the director of the Service Center and also one of the directors of the training program Intertrek. I'm also a trauma therapist and a psychedelic facilitator myself. And so I have many hats, and I also work in the education field, and I have taught many psychedelic facilitators in training, and I'm excited to keep doing so as we roll out the Colorado program. So at the Intertrek Center for Psilocybin Services, which is located in Portland, Oregon, we've seen approximately 300 clients since September 2023 when we opened our doors. We have not had any significant adverse events, and we have consistent feedback from clients and facilitators that they feel very safe in our care. Many people cite our high standards for screening and our wraparound care as a mechanism of supporting the trust that they feel going into the psilocybin experience. Most of our clients are in the 45 to 70 age range and are dealing with some kind of persistent mental health issue. We often hear things like, "I've tried everything else, and this is my last hope for healing." Clients often come to us struggling with treatment-resistant depression, anxiety, trauma, and addiction. And I'm thinking about one client in particular who had been trying typical treatments for his depression for 30 years with minimal change. After his 3-day retreat with us, he reported feeling lighter and happier and said he hadn't felt this way since childhood. After his integration sessions, he shared being able to connect with his children and his wife in a deeper and more meaningful way, and felt like he had a, quote, renewed outlook on life. Our goal is to continue offering a broad range of services, from open groups, retreats, and individual sessions to more community-specific oriented groups, such as the veteran groups that we host on a monthly basis. We have cancer survivor groups coming in, identity-specific groups such as men, women, queer-oriented, and BIPOC-oriented groups, and we're hosting research pilots as well. We are additionally a hub for continuing education, and we have a lot of offerings for hands-on learning for psychedelic facilitators and training, and host many practicums at our service center, and are very excited to continue doing that as Colorado rolls out. We feel confident that we will continue to offer our high level of care and expand our offering, and we're excited to see where the field evolves and being a part of this movement. Thank you, everyone, for being here. Back to you, Taylor.
Thank you so much, Emma. That is the end of our prepared remarks, and we are happy to open this up for questions, either typed into the chat, or feel free to use the React button at the bottom of your screen to raise your hand if you'd like to ask a question over the air. Okay, I've got a question from Ashley Quintana. What steps are being taken to ensure that this is financially accessible in Colorado? It's a great question, and we know that because of the intensity of these services, the amount of time that therapists are spending with their clients, that the cost of this does add up. I think there is, at this point, we are seeing in Oregon that the prices have come down since the beginning of the program. And that there are, as I mentioned earlier in my presentation, steps being taken in Oregon with nonprofits providing scholarships and service centers providing sliding scale treatment. Over the long term, there will be work toward insurance coverage as well as Medicaid coverage, but I think we're all aware that that's going to be a longer process. And we will continue to work toward that. But those are some of the things that we've seen in Oregon to work toward more affordability of this treatment. I would invite any of the other speakers, if you'd like to speak to this, please feel free. Yeah, Commissioner?
I would say one thing that I have found compelling about this is I think there are studies that have shown that one session of treatment with this kind of therapy has the healing value for that will last a year. And so as opposed to when you think about co-pays, you think about premium, all the kind of things that go into regular mental health treatment in other ways, the kind like regularity of it, your medications, those kinds of things, that while this may be something that some people need to save up for, and hopefully, and everything that Taylor said about scholarships and all of that is very relevant and important. I think in as much as this isn't something you're doing every week, you're doing maybe once a year, or you can maybe never again after that, I think hopefully the cost will bear out in that way.
Absolutely. Tasha, did you, or sorry.
Thanks, Commissioner. That's an important point, and I want to get to other questions, but I will just add one last piece, which is that both in Oregon and Colorado, there are elements to the law that support businesses developing either a social equity plan in Oregon or an environmental social governance component in Colorado. So it's really in the law that they have to be proactively thinking about ways to make this more accessible, especially to low-income people.
Erica, I see your hand raised.
I just wanted to add to what Commissioner Campbell said. So there are studies that have shown that this is effective to a year, but that's only because that's the last time that they measured the success of the treatment. So chances are this can go longer than a year. That said, speaking to your point, Ashley, I understand that although you can spread out those payments over the year in the sense of what it will save you, it's not going to help the person that does not have a lot of money to be able to put up front. What we need is rescheduling of this from a Schedule 1 drug to a lower schedule. That will allow insurance companies to be able to cover this medication. And thankfully, the DEA just increased production for the quota for psychedelic medicine for therapy. So they see the value. And I'm hoping that soon this will be rescheduled, and that will help.
Thanks, Erica. And Mickey, you had something else to add?
I agree with everything Erica just said about the need for rescheduling. And as we wait for that to happen, I know there are many facilitators, upcoming facilitators and upcoming programs that plan to implement outreach services to Coloradans and others looking for this healing service that can't necessarily afford the high out-of-pocket rates that we're seeing in some of the private sectors coming out. I know my program, the Center Origin, is one of those, and I'm very familiar with many other programs that are doing similar things so that this can be accessed by those who really need it most, because that's often found in high-risk, lower socioeconomic populations.
Thanks, Mickey. Esteban, I see your hand raised. You can come off mute. Thanks.
Hi, this is Esteban Hernandez over at Axios. Thank you for hosting this. This is just a general question. I'm not sure who can answer this, but is there a sense of how the federal government will monitor Colorado's program? Do you know if this will be like a formal and direct reporting process the state engages with, or is the expectation that the government will just kind of oversee its development from afar to see how it works?
It's a good question. And I think especially with a new administration coming in, it's hard to have a definitive answer for that. I think generally our expectation is that these programs will be handled in something of the way that cannabis programs have been handled, that as long as the state is providing significant oversight and working within the borders of the state, that will be left to the discretion of regulators in the state of Colorado. That said, it is interesting to note that one of the pieces of justification that was raised for rescheduling cannabis this year was the existence of medical cannabis programs and positive outcomes from those programs as a way of demonstrating that, in fact, medical cannabis does have value. So I think over the long term, there's a significant potential for these programs to help support changes at the federal level. Molly.
Hi, I'm Molly Cruz of Colorado Public Radio. I'm curious on what your reactions are to local governments already being a little bit resistant to psilocybin. Particularly, I'm thinking of Colorado Springs, who a few weeks ago passed an ordinance that essentially will ban healing centers from being in the city.
Sure. Commissioner, would you like to speak to that a little?
Sure. Make her do it. No, no, it's okay. Molly, that's a really great question. And I think, you know, one of the things that I think has been so important about the research, and exactly just piggybacking off of what we were just talking about, is starting with the medical and like really looking and understanding what its healing properties are. I think we know that there are biases against this kind of medication and this kind of healing. And, you know, local government officials are not always immune to letting their biases or their personal beliefs interact with and impact their decision making in terms of medicines and all of this. You know, I think it will be interesting to see how deeply restricted they are and if there's a suit that comes out of that or anything, because this is meant to be available statewide, and local governments are not able to really opt out. And so I think that will be interesting in a litigation scenario if that happens. But I think I would just encourage my colleagues who are still looking at this to set aside any sort of previous notions or biases that they have about these kinds of medications and therapy and healing, and look at the benefit that it can provide, the safety. I think this incredible presentation, the thoughtfulness of this, the really intense regulatory scheme that is around these therapies. I know even though I was already supportive, even sitting here, learned more about how tightly regulated it is. And I just encourage my colleagues to really open their mind and think about the rights to healthcare and healing that we have as people, and will lead with that.
Thank you, Commissioner. And yeah, I would just say it was disappointing to see Colorado Springs sort of reacting to without really considering the needs of their community. We know that there's a significant veterans population in Colorado Springs, and those are folks who have some of the most dramatic needs for this kind of work. I think we're confident that there will be many more localities like Commissioner Campbell's who recognize that this is critical care to provide for their citizens. And we hope that folks in the Springs will note that and be more thoughtful about making this care available. I'm going to go to the chat. From Brandon, how common is it for people to experience adverse long-term side effects from psychedelic therapy, and what help will be in place for those people? I can speak to this a bit, which is that it is not terribly common for long-term adverse effects. In fact, almost all of the adverse effects that get reported in the research are resolved within either during the session or within 24 to 48 hours after. And it is nonetheless important that we have the supportive structures built around this in the way that this program provides, with integration and support from facilitators, so that any difficulties, challenges, emotional challenges coming out of this are able to be supported by a trained facilitator. I'm happy to let anybody else speak to that if you'd like. Great.
I'm happy to answer that question as
Yeah,
well.
go for it, Emma.
Just we've been seeing a lot of clients in Portland, so I think that we're well positioned here. It's common with psilocybin work that things come up during sessions. And so when we think about long-term side effects, it is a part of the process that people are working through things in a deep and meaningful way, and actually is a part of what really helps folks in this work, is that something deep does come up and they do have a relationship with a facilitator through integration sessions to help continue process with that. And a really important piece of the training that Oregon has, and I was really happy to see Colorado reflect, is training on scope of practice and how to make appropriate referrals. So for us, if we have somebody come in who is maybe struggling with PTSD, has a history of some kind of trauma or long-term depression and anxiety, if their facilitator is able to help them have that deep journey with psilocybin, do some of those initial integration sessions where you're doing meaning making, you're kind of translating what happened into something that you can take into your everyday life, and then perhaps making a referral to somebody who is psychedelic competent and able to help continue that work if there is more needed work to be done. And so we actually see that as a positive thing of when people have these deep things come up and wanting to continue to work into it, because we see that being addressing the underlying root cause of what often is keeping people in these patterns of mental distress for long term. And things like HPPD, which is what we often, people talk about the diagnosis of persistent, it's hallucinogen persistent, I'm forgetting the last word, but it's when you have kind of the flashbacks from trips. It's very, very uncommon. We don't see it in this population, and there's not a lot of research around it. And so it is rare that that would come up, and we have a lot of support around people who are doing this work to continue long-term scaffolding with them as they move along their journey.
Also, just piggybacking off of that, want to really emphasize the amount of intention and mindfulness that went into developing the safety measures around this program, not only in clinical trials, but as part of the program. What we've done is in that initial safety screening, when any type of mild to moderate to high risk is indicated in the safety screening, the very next step is to then create a safety plan that will often entail engaging a primary medical provider, a mental health provider, to be able to manage any excess or high levels of distress that takes place during the experience or lingers afterwards. And so there is already a safety plan in place as people go into the administration to acknowledge and deal with just those things. And because of the safety screening process, it really is uncommon that we're seeing serious adverse events. Distress is a very typical part of this process, but health, life-threatening experiences, very, very atypical.
Thank you, Mickey. I'm going to come back to Ali Longwell's question. I apologize. I accidentally skipped over that in the chat. The question is, has Colorado's rulemaking concluded, or are there any items that are still up in the air? And I'm going to hand that over to Tasha, our resident Colorado rules expert.
Yeah, so both the Department of Revenue and DORA have adopted final rules for the program. DORA, or regulatory agencies, has reopened some of those rules to make a few cleanup changes, primarily around the participant confidentiality components, as well as some aspects of the training requirement. And then more recently, there's been a conversation around the at-home administration option, looking at adding further safeguards to that component. And so those conversations are ongoing. However, I will say that with the rules that are currently adopted, the state is still on track to open the license application portal at the end of this year. And so, especially because we know that there's going to be a lag before people are actually starting to practice, there's still time for them to finalize those pieces. And then the one other piece that we don't have, so we do have final fees from Department of Revenue. We do not have final licensure fees from DORA yet for the facilitator licensing. So that's another piece that's outstanding.
Thanks, Tasha. Okay, Owen Swallow asks, Trump's nominee for HHS has signaled a degree of openness towards alternative treatments like psychedelics. Is your organization looking to lobby the HHS for descheduling? I will say from HAF's standpoint, we are currently focused on supporting the success of the state programs. So that's really where our attention is for the moment. I think we're tracking what's happening at the federal level. And obviously as things develop there, where there are opportunities to contribute to continuing to expand access and making it possible for the state programs to operate more successfully, we'd certainly be in support of that. Federal lobbying is not currently part of the work that we're doing, and I think we'll mostly be monitoring that for now. Okay, and then a question from Chloe Ragsdale. She says the Open Mind Psychedelic Therapy Expo had a demographic of mostly women, and we're seeing women heading the panel today. Why do you think psychedelic therapy treatments are so appealing to women, and how do you see these treatments impacting women-specific mental health issues? I'll speak briefly to this, but I'm sure others have perspective too. I think one of the things is that, we know that women are typically the ones making healthcare decisions in their families, and so are really attuned to developments and progress in this space. I also think it's often overlooked when we talk about trauma and PTSD that the largest population of sufferers of PTSD are women who are survivors of sexual assault or domestic violence. We often focus on veterans, understandably, because that's a very visible population that is affected by this. But it's important to know that there's just as large and actually larger population of women who could really benefit from having an additional tool to deal with this kind of trauma. So I think those are two things that come to mind for me, but I'd love to open it up to others on the panel who'd like to address that.
I know this is probably not answering the question being asked, but I do want to, signal that although this particular group is definitely women dominant, there are quite a lot of men and non-binary and other people participating in this process. And, I personally, in my role at HAF, had spoken with Coloradans across the state who have personally experienced healing from psilocybin and other psychedelic therapies. And it includes a lot of men for whom the impact has been very pronounced and life-saving in many cases. I've talked to people that have struggled with treatment-resistant depression, veterans with major depression and PTSD, and others who have found this to be beneficial. So it's definitely not exclusively for women. And I know that's not what was intended by the question, but just wanted to be upfront about that.
Would also consider the fact that historically speaking, women have been more willing to come forward about mental health issues before men do. And so I think this is probably another, I don't think that's the only factor, but I think that is probably one factor contributing to the imbalance that some people are seeing right now, and that we live in a society where women feel a little less encumbered in speaking about their mental health. And I think that as this picks up and we do start to see how effective and how much healing comes out of this, that it will not be gender specific.
Yeah,
I'll also jump in just real quickly and talk about how a lot of the medicines that are out there have been studied based on the male body as opposed to the female body. And so I think women seeking out alternative methods of healing, and therapy, especially as it relates to our physical person, you try SSRIs, you try all these different things. They have all of these different, they can impact your sexual health, even though they're trying to impact, your anxiety. And there's all of these different side effects that having something that's natural, where you don't have to test run, a antidepressant for 3 weeks. I will say that I tried an antidepressant at one point, and I was already struggling with depression and trauma, and it made me basically comatose and non-functional for about 3 weeks while we tried to figure that out. A lot of women, especially caretakers, don't have that kind of time or luxury. And so things that can be addressed in one full day, investing in that kind of time, or, I think we've seen the articles of moms microdosing and things like that. I think, there's a lot where women, our bodies and the chemicals in our bodies and hormones have not really been studied by science appropriately. And so I think we know that through our own experiences, and it makes us open to alternative solutions.
Thank you, Commissioner. We are at time for our briefing. Thank you so much to all of you who have participated. I would just encourage you as members of the media to reach out to Healing Advocacy Fund anytime you have questions about the program, about the progress. We are here as a resource for you. And we really appreciate the opportunity to share what we know and connect you with other people in the community with this expertise. Thank you so much to all of our panel participants for your time and expertise today. And we will be sharing out the recording of this to participants and are happy to share this with others if there are people that you know who would like to have a chance to review it. Thank you again, and please reach out to us anytime.